It's all about taking care of our keiki. The Department of Health is moving from awareness to acceptance for National Children's Mental Health Month. Joining us this morning is Dr. Scott Shimabukuro, Acting Administrator for the state's Child and Adolescent Mental Health Division. He has more details and more tips for parents. Good morning, Doctor. Thanks for joining us.
Good morning.
Can you talk more about what Children's Mental Health Acceptance Month is all about?
It's a month where we highlight the mental health challenges that kids and young people face, and it appears coming out of the past 2 years with increased parental and family stress, mental health challenges are more prominent now more than ever. This month is a time for us to say we accept that 1 in 5 young people struggle with mental health challenges. And as families and schools, communities, we really need to support our kids. And if we all do what we can really make a difference. The color of Children's Mental Health Acceptance Month is green. Green is the national color of mental health acceptance, representing hope and strength, support, and encouragement for people who suffer from mental illness. Look for buildings. We've asked buildings around Honolulu to light up green. This week we have Aloha Tower, Hawaii State Capitol. I went there last night. Hawaii Iki Tower and Honolulu Hale are lit green in support of this month.
And Doctor, I've got my green dress on as well in support. Now, you said 1 in 5 is the statistic, and that's very unfortunate. Surprising news for parents and adults. So tell us, what are some of the signs of mental health issues in keiki?
One of the things we want to do is notice changes in behavior or mood or thinking. For example, if appetite or sleep noticeably changes, whether it's more or less, have they lost interest in doing things they used to enjoy? Is a particularly social kid more withdrawn now? Other things need to be considered because not every change is due to emotional distress, but it's a place we start to look at. You know, there may be physical concerns that affect mood and behavior, so it may not be emotional distress. Or it could also even just be habits. For example, my own kid, he stays up really late in bed looking at his phone, and even I hear him talking to friends, and this disrupts sleep. All of these things can affect the next day's school performance as well as their mood and behavior. So we want to consider a variety of things, but it's a good starting point.
And sometimes your child might just be going through some changes, you know, growing up from adolescence to teenagers where they kind of don't talk as much and, you know, their habits and hobbies have changed. So sometimes it can be hard to spot the signs. So I'm glad that you mentioned some of them, and, you know, for parents not to get too alarmed too quickly and to always ask for a doctor's advice. What can parents do to prevent the development of mental health challenges?
Yeah, there are a variety of things. You know, we don't have time to go through everything, but I'd like to mention routines and rituals. Routines and rituals have a protective effect on our kids. I know family life is complicated and not one single family can be totally consistent, but if you can eat together, celebrate birthdays, walk the dog together, these things go a long way. My family, every Sunday, we get together with the grandparents and an auntie to have dinner. I think the predictability, stability, and nurturing quality of family activities go a long way to preserve mental health. During the pandemic lockdown, we would eat dinner in the garage and with open air and social distancing, and Popo, or grandmother, could still bless us with her amazing cooking, which was done out of love. So routines and rituals.
I like that.
Yeah, that's really important.
And a lot of people have big families here, but it doesn't have to involve a lot of family members or a lot of friends. It could just be you and your parent going for a walk every Sunday morning or something like that, or just going to get breakfast, right?
Right, exactly.
So if a parent thinks that maybe their child might need mental health support, what should they do?
I think going to your pediatrician for a recommendation, that may be a first step. Also, schools can offer different counseling support for struggling youth. Students or supportive adults can ask the school about counseling services. There are also many well-qualified private providers for individuals and family therapy. So people can check with their insurance plans about which providers are covered. And, you know, reach out to friends and family for support. And the Child and Adolescent Mental Health Division, which is the Department of Health division that I run, also provides mental health services for free, but it's for those who qualify, and it's for more of the serious emotional and behavioral challenges.
All right. Thank you so much, Doctor, for joining us. Very important issue, not to just raise awareness or recognize this month, but every day. Thanks so much, Doctor.